Hey guys, and welcome back to Clinical Physio with me, Phil Richards. In today's video, we're going to be going through the special test, the metatarsal head squeeze test. So the purpose of the test is reproduce a patient's pain somewhere around the metatarsal heads. And the way it works is that we have interdigital nerves between the metatarsals here. And when they become inflamed and sore from compression and irritation, then by doing the test, by squeezing and compressing, we're going to irritate and bring up their symptoms. So how do we do the test? Really, really simple. We just come from the medial and the lateral aspect, pushing at the MTPs, and we just try and compress everything together. It's a firm squeeze, and that's it. And then we're looking for the reproduction of their pain. Do we like this test? Oh, I very much do. It's very good at bringing on metatarsal interdigital nerve irritations, and particularly you're going to find around the second and third. This is a commonly irritated area and it's known as Morton's neuroma. You'll find other signs from the subjective examination, such as it feels like my sock is rucked up, or I feel like there's a stone in my shoe, but when I look I can't get it out. These are all signs that we're getting this interdigital nerve irritation or compression. So if we're thinking about what causes it and the compression, then part of your initial physiotherapy might be to try and relieve what's causing that compression. So this can be from a tight peroneus longus, or this can be from excessive overpronation causing extra compression, or it can be someone that's got a very tight calf and that's causing them to weight bear more in their forefoot, or it could be weight bearing more in the forefoot from a postural occupation. So you can use that along with this metatarsal head squeeze to help form your diagnosis and also your treatment plan.